Welcome to the Trust Driven Care podcast. Today is Trivia Day, where we strive to make medical research more fun. I'm your host today, Dr. Melanie Short. I'm a chiropractor out of Clarksville, Tennessee. This week, I'd like to introduce you to our trivia contestants. First off, we have Kurt Kippenberger, a chiropractor from Missouri. We have Dan Swisko. He is a physical therapist from Scottsdale, Arizona. We have Amanda Satterlee, a chiropractic radiologist from Las Vegas, Nevada. And we have Ed LaCara, who is a sports medicine specialist from Dallas, Texas.
What's up, everybody?
Glad to have everybody here with us today. And we have Amanda was actually our runner-up last week.
Oh, yeah.
So we're going to see if she's done anything this week to prepare to do a little bit better, maybe win that number one spot.
Odds-on favorite.
Our trivia game today is going to consist of 6 questions. Our contestants are going to write down their answers, and then they'll present them to us after 1 minute. Each question is going to be worth 10 points today. So you have up to 60 points to get. And whoever the winner is, one will get bragging rights to the next week. And they will also get a donation towards whatever state medical organization that they'd like to donate to in their name. All right, so we're going to get started. Okay, so question 1. This article was by George Minolis Jr., and it was in the Health Marketing Quarterly Journal from 2009. This article is titled Closing the Gap, the Patient-Physician Disconnect. And here is your question. So timing is starting now. What percentage of patients seek support for their emotional feelings first before their physical symptoms? So we're looking for a percentage. I'm going to give you some leeway. You can get 10% on either side. We're being generous here.
They actually came in the clinic
feelings before
for their emotional feelings prior to their physical, not what the provider thinks they need to address first.
Yeah, so patients come in, they have back pain, let's say. They come in for back pain, but what percentage of them would prefer to have their emotional feelings addressed first prior to their physical symptoms?
Or we're asking what's their preference, not like did they seek professional care emotionally before they did musculoskeletally? Is that where the essence of the question is supposed to be?
More so, do they want their emotional well-being to be talked about or just their physical symptoms? All right. And we have time. Okay, so let's see. Amanda, what do we get?
I put 80.
Okay, Amanda's got 80%. Dan?
I'm thinking it might be higher.
I'm feeling good. I matched him.
80%? All right.
Did about that.
I went with 90 because, I think that, dudes not so much, but I think the women, want their feelings addressed.
100%. I would totally agree. I was thinking higher. All right.
And Kurt, what do we think?
Somebody's got to be the black sheep. I went with 15%.
The contrarian of the group.
So, Kurt.
In that clinic down there.
This podcast is about patient communication, FYI.
I'm not saying that I don't want to address it. I'm just saying that he might not want to address it.
Okay, surprisingly, is 90%.
I didn't get one question right last week, by the way. So this is amazing.
Well, good. I'm off counting.
Nice.
There we go. Good start. So I'm sorry, Kurt, but everybody else got a point there.
That's all right.
Yeah, it was a small article written about focus groups. There are 150 focus groups that they looked at. Essentially, the underlying drivers of customer satisfaction in a healthcare setting. It was pretty cool because they used different healthcare settings. It wasn't just chiropractor. It wasn't just physical therapist. It wasn't just an MD. They kind of looked overall to see what patients wanted to have looked at first, and they want to feel good about their practitioner before they feel better about their physical health.
Yeah, that makes sense.
I remember years ago learning that the indicator, let me say this right, the number one indicator to best predict a successful outcome of rehab was the relationship between the practitioner and the patient. And they used the term therapeutic alliance for that relationship. And that is stronger than how many letters are after your last name, how many years in practice, how much time you spend with them, et cetera. So it's really big. It's important for sure.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up.